Imagine seeing inside the human body without a single cut. That's the power of MRI, using radio waves and a magnetic field 60,000 times stronger than the Earth to create detailed images of soft tissues. From diagnosing strokes to detecting tumors, MRI is a life saving tool in modern medicine. Let's uncover how it works and why it is so essential. We will discuss about physical concepts, real-life example in medicine, medicine condition, and the benefits and limitations of MRI. So firstly, MRI use radio wave, which is a form of electromagnetic radiation. You can think of them like the wave you might see in a pond when you throw a stone, just like those waves travel across the water. Radio wave travel through the air. In an MRI, we use D wave to communicate with the tiny magnet inside your body. And inside the MRI machines, there are special part called radio frequency coil. This coil creates the radio wave that we just talked about. They send these waves into your body to interact with the water in your tissue, which is crucial for getting clear images. Now let's see how these waves work with your body. Our body are mostly water, and the hydrogen proton in the water molecule act as tiny magnet. In an MRI machine, they align with the magnetic field. A radio frequency pole disrupts this alignment, and as proton return to position, they release energy. Basically, when we send the radio wave, they give the proton a little push, causing them to flip and spin. After we stop sending the wave, the protons start to return to their original position, and as they do this, they send out the signal that can be detected by the MRI machine. The signal that come from the proton are different depending on the types of the tissue they are in. Think of it like the different musical notes from different instruments. The MRI machine captures these signals and uses them to create detailed pictures of the inside of your body. The MRI machine has several important parts. The main magnet is a big part that creates a strong magnetic field. There are also gradient coils that help focus on specific area, and the RF coil that send and receive the radio wave. The time taken for an MRI scan can vary. For example, a scan of your brain might take 15 to 45 minutes, while abdominal scan could take 30 to 60 minutes. It depends on the area being scanned and how detailed the images need to be. MRI is highly effective for imaging soft tissues. It can scan the brain and spine to detect strokes, tumors, or injuries, as well as joints and bones for examining ligaments and cartilages. It is also used to assess organs in the chest and abdomen, such as heart, liver, or kidney, and evaluate blood vessels for blockages. Muscles and soft tissues can also be diagnosed for injuries or tumors. However, MRI is less effective for air-filled structures like lungs, which give out weak signals, or for teeth and dense bones, which lack water content. In these cases, CT scans or X-rays are preferred. Metal implants can distort images, and moving organs, such as those affected by breathing or digestion, may reduce clarity. While MRI excels at imaging soft tissues, it has limitations with dense air-filled or moving areas. Doctors use various MRI techniques to diagnose conditions like strokes. Diffusion weighted imaging (DWI) highlights damaged brain tissue as bright spots, showing swelling and identifying causes like clots. Perfusion weighted imaging (PWI) maps blood flow, pinpointing salvageable tissue at risk but not yet permanently damaged. FLAIR estimates the age of brain damage. If damage appears on DWI but not on FLAIR, the stroke is likely recent. Gradient echo (GRE) detects bleeding or clots, which appear as dark spots. These techniques work together to provide a detailed picture. We chose lung cancer as the medical condition to focus on because it is one of the leading causes of cancer related with deaths worldwide. Early detection and precise evaluation are critical in improving outcomes. While CT scans are commonly used to detect lung cancer, MRI scans offer unique advantages, especially in assessing how far the cancer has spread or examining soft tissue structures like the chest wall. This makes MRI an essential tool for ensuring no critical details are missed in diagnosis or treatment planning.
Doctors use MRI scans to help diagnose lung cancer by creating detailed images of the lungs. Brighter areas on the scan often indicate tumors, while darker areas represent healthy tissue. When contrast agents are added, they make tumors stand out by highlighting the increased blood supply. This helps doctors accurately determine the tumor's size, shape, and location. Combined with biopsy results, MRI scans are essential for monitoring tumor growth, evaluating treatments, and planning surgeries for radiation therapy.
Benefits. So the first benefits of MRI is the comprehensive imaging capability. So for doctors, MRI allows for detailed visualizations of any part of the human body in multiple directions. This enables precise diagnosis and treatment planning. For patients, it ensures accurate and non-invasive diagnosis, which reduces the need for exploratory surgeries and enable early detections of diseases. So the second benefit of MRI is the non-invasive and radiation-free. So for doctor, because MRI avoid of ionizing radiations, make it safer options for imaging, especially for patients that require multiple scans. And for patients, it also minimizes long-term health risk associated with radiation exposure, making it particularly beneficial for children, pregnant women, and those requiring repeated imaging. Despite the benefit, MRI also poses some limitations and risk. First, MRI requires patients to stay still for a long period of time, which can be difficult for kids, those in pain, or people with anxiety. The high cost of machines and scans also limits the accessibilities, particularly in under-reserved areas. Additionally, implants like pacemaker or insulin pumps can pose risk if not MRI compatible, potentially causing malfunctions, burns, or poor imaging quality. Secondly is the risk. So, since MRI has the strong magnetic field that can turn metal objects into dangerous projectiles, making screening essential. The process can be uncomfortable due to loud noise that may require ear protection in the enclosed space, which can trigger claustrophobia. Long scans may cause body heating and risk include burns, allergic reactions to contrast agents, or complications from sedations, which is sometimes necessary.